I'm Dr. Mrinalini Sharma. I'm a plastic and cosmetic surgeon practicing in Aestiva Clinic, Saket. Today in this video, we're going to be talking about puffy eyes, which is a very common condition and a source of concern for many of our patients. Today, I'm going to be telling you about the causes of puffy eyes, what are the signs to look out for if you have this problem, and also what are the remedies available for treating this condition. Puffy eyes is a very common condition and usually starts appearing as early as late 20s, and the most common subset of people whom we meet in our practice is in the 40s to the early 50s. So what causes puffy eyes? Puffy eyes can be caused by certain lifestyle problems like lack of sleep, dehydration. So what happens is when you're dehydrated, the body tends to retain more water, causing puffiness around your eyes. Excessive alcohol intake is another cause of puffy eyes, and also certain health conditions. So what health conditions are we talking of? We're talking of kidney problems, thyroid problems, and also high blood pressure, which can lead to puffy eyes. In order to treat these problems, we have to first focus at the root cause. So if you think that your lifestyle needs to be modified, meaning that you have to change the conditions which I have mentioned, you should ensure that your sleep is adequate, you refrain from a high salt intake. Also, if there are certain medical issues like your kidney function test is abnormal or your thyroid function test is abnormal, then medications are needed to resolve this problem. Another common reason which could lead to puffy eyes is the presence of allergies or in certain cases infection. What are the signs to watch out for? So if your puffy eyes are persisting beyond a certain period, say if you're persisting for several weeks despite your lifestyle changes, then you need to consult a doctor and get to the root cause of it. Also, if there are certain alarming signs, by alarming signs, what do I mean? I mean, say a painful red eye, vision changes, or swelling just in one eye, which is asymmetrical. These are all potentially signs of an infection and should be immediately taken care of by an experienced doctor. Now, what are the home remedies which one can observe so that the puffy eyes are reduced to a certain extent? One is the use of cold compresses and also say caffeine-based creams which constrict the blood vessels and thereby they reduce the puffiness. Also limit the use of alcohol and get a proper night's rest and a good night's sleep. So all these are lifestyle modifications which can reduce the appearance of puffy eyes. Most common cause in the 40s is the lack of elasticity of the tissue and aging changes which lead to the appearance of puffy eyelids. So in this case, one would need cosmetic measures like say a skin tightening procedure using lasers or using Morpheus 8 or microneedling, or say camouflage using fillers, which is again going to take care of the appearance of puffy eyes because of loss of volume. The third obviously is the surgical procedure, which is considered the most permanent or the most longer lasting among all these procedures, in which we surgically remove the puffy eyes by a process known as Blepharoplasty. So these are the various techniques which one should be looking at when he or she is considering the treatment of puffy eyes. Let me tell you as to how these procedures differ from each other. If you have taken a laser tightening treatment, then the results are going to be somewhat minimal and are going to last you for a period of a few months and would need repeated sessions. Dermal fillers would address the problem only if the eye bags are not too big and are also accentuated because of the presence of hollowness. So what fillers do is they cover the hollow spots and in essence, they camouflage the presence of eye bags. However, if the eye bags are very large, then surgery is the best option for you, which gives you results lasting for as long as 5 to 6 years or even more, providing that your lifestyle is good and also you have no underlying other health conditions. Overall, blepharoplasty, if I talk about the surgical procedure, is a short duration surgery and usually takes about 1 to 1.5 hours, can be performed both under local anesthesia and general anesthesia. The biggest concern about this surgery which patients have is if it's going to affect their vision. So the answer is no. We are not anyway close to those areas or those structures which address vision. So doing a blepharoplasty for removing your eye bags is not going to cause any difficulty in vision later on. You might have temporary excessive tearing or temporary blurring of vision lasting for 2 to 3 days, but that's more about it. It's not really going to cause any permanent vision changes. Another question which patients have when they come to me for a blepharoplasty is whether it's going to have any visible scars. Again, blepharoplasty can be done through very minimal incisions in the lower eyelid which are not visible as they're in your lash line, or in certain cases we go inside the eye called the transconjunctival approach, in which no external cuts are given whatsoever. So overall, people are generally very satisfied with the results of a blepharoplasty, and these can give you very satisfying results and resolve your problem for a long time. This is all about puffy eyes from my side, and if you have any further questions or any doubts regarding this procedure or your problem, please contact us and we'll be free to help you and reach out to you. Thank you.